course, many countries around the world would say that nationals have to come first. Usually, the foreign ministry will usually not talk about future plans unless it is kind of successful already.
It's been almost 2 years already as the spokesperson for Sobocor. How was it, and what is the most difficult thing about this role?
Yes, thank you for the question, Kun Thitapha. Yes, it's almost been 2 years already. You're right, and we've been trying our best to communicate to the English language audience from the daily press briefings at the CCSA. Every day we have to, of course, monitor the situation and, of course, the various adjustments in the measures that come out throughout every meeting with the changing situation. So it's quite a challenge to be very much on the move every day. At the same time, I'd have to summarize the Thai language version. That's around 50% of it. And the other 50% is the information that may be useful for the English language audience. And the challenge is perhaps we have to look at this in a way that we are communicating in a crisis. It's a crisis communication. So not everything will turn out perfect. You have to look at it in a way that it's an ever-changing circumstance. And of course, adjustment is part of any plan. Adjustment is part of any plan in an emergency situation. So we tried our best during the CCSA briefings for the English language audience. Of course, we have many things to improve upon, and we've been adjusting on a daily basis. It's not easy. It's difficult for everybody in the CCSA, but I think it's the first time that Thailand had such kind of briefing to the foreign community and foreign press during a national or international crisis. I think it's the first time.
So could you tell us briefly about what is the first priority for MFA Thailand during the COVID time?
Yes, so I think in terms of priority, firstly, in terms of taking care of Thai citizens who remain abroad and have to face the various challenges of COVID. So that is one important priority that the Thai embassies are working on continuously. They have never stopped taking care of Thai nationals abroad since the outbreak of COVID. The second priority, of course, is also about the foreign community in Thailand, wherein they remain in the various schemes to be vaccinated. They are part of the vaccination drive of the country. So, of course, our policy is everybody on Thai soil will be vaccinated, and the Foreign Ministry is working on this with various agencies like the Public Health Ministry to make this happen. Of course, it's a national crisis. It's an international crisis. It's a global pandemic. So I guess many agencies have to work and do things beyond their usual tasks or duties. So usually we would not deal much with foreign nationals in Thailand. It would be more of their embassies or immigration department and all those other local domestic departments, agencies that handle their documentation. But in this type of crisis, we, of course, have been pulled in to assist with the vaccination drive and the communication to foreign nationals.
I think a lot of people are focused on about vaccination plan for foreigners who live in Thailand. So what is Thailand's position about equal access to COVID-19 vaccines?
Well, the policy that we have is that it is to have equal access for everybody, regardless of nationality and regardless of any particular age, gender, and the like. That is the general policy. But of course, in practice, I think no country in the world can have every single person do it at the same time or at the same place. In many countries, they have mobile units vaccinating people outside the centers, or they use a lot of private sector cooperation. But of course, in Thailand, the context in Thailand is a little bit different. We have to prioritize first the elderly and also those who are at risk. The situation in other countries might be different, but for our case, the medical personnel, the frontline workers, have been affected at a high rate, and the death rate, which is now at 0.8%, affects the elderly a lot in Thailand. Our statistics of the median age, the average age of those who died in the past 1.5 years, a lot have been the elderly in Thailand. So because of that difference in information, for Thailand, we had to prioritize the elderly and frontline workers first. But this does not mean that the general policy is erased or taken away. Of course, the general policy is that everyone will get their turn, but not at the same time. That's all. As in terms of nationality, of course, we will not discriminate according to nationality, because we believe in the principle of physical presence. So if you are physically present in an area or a country, COVID does not distinguish between nationality, but if you are physically present in Thai society, for example, you are at the same risk of infecting others. You're at the same risk of infecting yourself as well, with that physical presence kind of approach. So that's how we look at it. But of course, many countries around the world would say that nationals have to come first. Some countries would not say so and say that it doesn't depend on nationality. For us, we will not discriminate. It's just that we have to take turns. So as you can see, the elderly Thais and elderly foreign nationals have been vaccinated in approximately the same or similar timeline. Okay, and frontline workers as well. If there are foreign frontline workers, of course, they will be in the similar timeline. I guess it's something of an approach in terms of having a nationalistic approach as well. But in this kind of crisis, I think that has to be erased, taken away. The many foreign embassies have been coordinating with the Thai side, either providing vaccines to Thailand or in terms of the organizational type of vaccines. So for diplomats, for example, foreign nationals that are diplomats, it's according to the arrangement that we have with each country. But the general policy remains the same, that we will vaccinate everyone on Thai soil without discrimination.
Talking about vaccine, a lot of Thai people try to send a message to FA Thailand about COVAX, about vaccine diplomacy. So could you tell us briefly about what is the latest movement from MFA Thailand?
Concept of ever-changing circumstances that change all the time, and adjustment is part of any plan in this emergency situation. So we have given importance to vaccine diplomacy for Thailand. We have engaged with many countries around the world. I have to say that without many people knowing about this, the foreign ministry has been engaging with so many countries around the world through our embassies and seeking for information, for sources of vaccine, either for purchase or for exchange or for donation. All of these collaborations have been going on, but of course it takes time because every country has their own internal vaccine situation. Usually they say that, of course, we do work which is behind the scenes. We put the gold leaf behind the Buddha statue without people knowing the actual result that it comes from us, or we have been taking part in this. So I guess the ever-changing circumstances has to be something that we look into every single day. Now, for any scheme that was mentioned, either COVAX or any collaboration, multilateral coordination, we are looking into the detail of how to make that adjustment to work best for our country. So what's important is, I think, that we will look into what is best for Thailand, either to join any agreement or any scheme or not, or have a role in it in a way that is most appropriate to Thailand. So that's, I guess, kind of general, but that's what I can say for now. Usually, the foreign ministry will usually not talk about future plans unless it is kind of successful already, or sometimes when even if it is successful, we will not talk about it, how it came about, because sometimes it takes a lot of negotiation. And definitely, if it's successful, usually we do not speak out to take much credit for it. Yes, so my advice to foreigners who have to go outside, of course, after 9 p.m. if you are in the Bangkok or surrounding provinces, or just during the daytime as well. My advice is that you would have to, it would be best if you have all your documents at hand already in case there is a question on why you are traveling in the nighttime. But there is a reason that is an exemption for everybody, not only Thai nationals. But of course, if you go to see the doctor, if you go to buy food and all the necessary essential items, the enforcement officers will be using their reasoning, which is a reasonable understanding of the reason why people have to go outside. Of course, if you go outside to buy food, no one's gonna question you. But if you go outside and it's kind of obvious that you're preparing to go to a party and things like that, of course it would be a different situation. And of course curfew hours as well. For those who violate curfew, the penalties are the same as for Thai nationals, of course. There's a fine of 40,000 baht and imprisonment of 2 years, not over 2 years. Fine or imprisonment, or fine and imprisonment. This is according to Article 18 of the emergency decree, and I think this will be in the 14 days. That will be ending soon already on the 2nd of August. So my advice is just have documents ready, and keep in mind that authorities are reasonable because they understand that people have to live their normal lives to some extent. If you're transporting things for business, you have documents ready. If you're going out to get vaccinated or buy food or any emergency situation, I'm sure that the officials will understand. And your various embassies, foreign embassies, have been informed of the details of our new measures already. There had been a note verbal to all the embassies regarding the updates. So I think the foreign community in Thailand can be rest assured that there will be no unreasonable kind of situation.
For the last question, what is the best channel for foreigners who want to access or get the information about COVID-19 in Thailand?
Yes, so foreign nationals can avail of many sources of information. Of course, aside from the English language press, you would have to see about the accuracy as well. Your embassies will be a good source for information. Many embassies post information regarding the latest measures. If your embassy does not post, you can look at the website of other embassies as well. There is the daily press briefing in English that if you view it on a daily basis, you will get a good picture of how things are moving along. If you watch it only once in a short while, you might have to get updated on the information of the next day or the next week. There's also the English language social media of the Public Relations Department, PRD, as well as the Ministry of Foreign Affairs. Usually these have infographics that are easy to understand in English of new measures that have been announced. There are also social media pages, which may be in Thai. So if you have Thai friends, you can also have them look at it for you. The Sabakh CCSA pages, as well as the Ministry of Public Health. The Ministry of Public Health also has an English language Twitter account also, which you can follow information from there. So there are many sources. The most important thing is that you have to try to get the most accurate and most up-to-date information. If it's from English language media, which does not seem so trustworthy, best that you check with English language media that is mainstream, trustworthy, as well as the official sources. Check information against one another in English. I know that English language information is not very, very much available in Thailand compared to other countries, but there is, and I hope that you make use of all of these channels. Also, I guess English language programs like Nation Talk as well.
Very good. Okay, thank you for today. Thank you for being here also. ขอบคุณมากค่ะ